And what comes next?
So what comes next is autonomic rehabilitation. So this is a specific brand of rehabilitation that targets the autonomic nervous system. And over time, it slowly helps your body to get used to challenges to the autonomic nervous system. So with most patients with PACS, we actually need to start with the patient laying flat because their symptoms are so extreme that even trying to do some of these exercises upright are just too exertional. So we will start with very gentle movements that trigger the body's autonomic nervous system just a little, but just enough that they can slowly tolerate it. And then over time, we increase the challenge with a lot of respect toward patients' symptom exacerbation. So we really need to make sure that nothing we're doing is high exertion enough to trigger symptoms, and we need to move very, very slowly with a lot of respect to that. As what we've seen over time, as we've rehabilitated hundreds of patients, is that this rehabilitation approach eases symptoms. We don't think it's a cure, but we do believe that it is addressing some of the most debilitating symptoms. And what we've seen is that after roughly 3 to 4 months of intensive rehabilitation, we can discharge patients at a point where they're saying, I feel like I did pre-COVID, and I feel like I can continue management alone. Now, I will caution that we've also seen relapses after discharge, indicating to us that this is something that is going to be chronic management, that we're going to have to keep an eye on over time, and for how long, we're not sure.